Look at physician compensation, going back 30 years ago to now, like if you look at the percentage of how much our income has increased, it's been negligible. It doesn't even keep up to inflation. I'm talking about like employed physicians. So these hospital systems, these clinics, they're just taking advantage of us. And the reason why they're doing it is because we're just not educated enough on business and financing and all these things. And the root cause of that is because in our training, they just taught us just to be, little soldiers for these hospitals and to keep your head down and keep working and to just focus on the patient. They take advantage of our altruism and the reason that why we went into medicine.
Hi, everybody. Welcome to Be Empowered, the podcast. This is the podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
I'm Dr. Shala Mokbel.
And today we have a very special guest. We have our friend and colleague. We have Dr. Franklyn Rocha Cabrero. He's a board certified neurologist and neurophysiologist. He's also the CEO of RevDoc Neuroanalysis. And so thank you so much for joining us today, Frank. Do you want to introduce yourself a little bit to the audience?
Of course, thank you for inviting me. So my name is Franklyn Rocha. I'm originally from Puerto Rico and came to the U.S. in my mid-20s and then I did all my internship, residency, and fellowship here, and I reside in California.
And so, one of the reasons we wanted you on, and we're friends outside of the show, so we know that you're someone who does locums contract, that you went into locums work pretty much right after fellowship. Is that correct?
Correct. Yes, straight out of fellowship.
Yeah. And so that's pretty unique, right? Most people while they're training don't even realize there's a world outside of W-2 work. So can you tell us a little bit about how that kind of worked out for you and what made you choose to be a full-time locums physician?
I started mid through fellowship. I did my fellowship at in Irvine, and I noticed that a lot of my supervisors, my attending supervisors, were working late, till 10, 11 p.m. every day between doing clinic, hospital work. I mean, they supervised me doing seeing patients in the epilepsy monitoring unit. So for the audience, we kind of admit patients to figure out where the seizures are coming from and see if we can do surgery or if there's any other options. So I ran that service as a fellow, and on top of that, they also had to read the EEGs, the electroencephalograms from the hospital. So my supervisors had a really really just bad work-life balance. They were working till late, just like me. And I said I do not want to be one of those neurologists. So I reached out to a friend who had told me about locums to just give me recommendations or if there's any, resources or books that he recommended. And he recommended me Dr. Andrew Wilner's book on locum tenens. So I read that. I remember it was vacation day. I read it in an entire day. It took me one day to read. It was a really straightforward book. And when I saw the pros and the cons, and I saw that the pros were higher, I was like, this is what I want to do. I want to do it straight out of fellowship. So what I did is I asked Dr. Wellner what was if he had any contacts with any locums agencies that he trusted. So then he got me into contact with Com Health, and that's how I was able to get my first gig out of fellowship. And I think I contacted her about 6 months before I finished my fellowship, and I was able to get something actually in Northern California, in Salinas, California, and it ended up being a great experience. And for me, it was great because I was kind of burned out from fellowship, so I ended up going to Salinas only 7 days a month, and the rest of the time I just took it off because I was burned out. So for 6 months, I get to stay home and work 7 days. 7 days I would be in Salinas, and then the rest of the time of the month I would be back home, and that worked out really great for me.
What were some of the biggest challenges that you had as an independent contractor?
The biggest challenge I think is there's just a lack of mentorship. A lot of the people that you're surrounded with in training, they all trying to, trying to steer you towards academia or towards getting an employed job because that's what they know. So I had to do a lot of reading on my own. I had to look for outside resources like physician side gigs or white coat investors, and kind of have to figure out like how would you do this. So one of the things that I found out is that I have to have my own accountant. I'm going to have to do my own taxes. I'm going to have to open up my own corporation. I have to look for a contract lawyer or a company that does contract that's specialized in looking at physician contracts. So that was a little bit overwhelming at first. So it took me a little bit of time to kind of figure it out. So that's a little bit challenging. You have to be motivated and kind of self-taught because a lot of these things really aren't taught in my training, unfortunately. So you kind of have to somehow figure it out.
Yeah, a lot of them are not self-taught. And I know you mentioned Calm Health as a company you worked with initially. Do you also do contracts on your own? And if so, how do you find them outside of a recruiting agency?
So yes, I do. Those are the best way to get your own contract really is word of mouth and using your network. So for example, I have a contract in South Dakota, breeding EEGs, which I wouldn't have been able to get it if my friend wasn't a medical director there. I was a resident, and he was the fellow for epilepsy down in Miami. So we developed a really close relationship. And then he just told me, hey, we need somebody to read inpatient studies. You wouldn't have to do call, it would just be the official read, that's it. So I was interested. And then so I was able to do the contract directly through my entity without any agencies. I had to do my own contract, obviously, had to negotiate with the medical director. And then once the contract was done, then the hard part was licensing and credentialing. That can take like between 3 to 6 months. So you have to be really patient to get these contracts on your own, but they're worth it because cutting out the middleman means that the profit goes to you, and also you have more flexibility in what the contract says if it's under your own company or corporation. Versus through an agency, there's going to be little caveats that you're going to have to be kind of aware of, and that those could be like you can't really work for that hospital. Let's say if you contract through Calm Health and have you do locums in a hospital, there's a certain timeline that you have to wait before they can work with you directly, or the hospital will have to pay a very hefty fee. That's kind of in their contract, and also it depends on the state. So some states have non-compete laws that can make it really like even harder. If let's say if you directly contract with the hospital, once you leave that hospital as an employee, there could be clauses in the contract that would preclude you from actually being able to contract with them directly. So, those are little things, again, not taught in training, are things that you kind of have to navigate and on your own, or if you have a mentor who does, this kind of independent contract work or who has experience with this, then that would be a good person to reach out to.
Do you draft your own contracts and give it to the hospitals to edit, or you ask for a contract and then you edit it with the help of an attorney?
So I've done both, but hospital systems are very resistant to contracts that you do on your own and give it to them. They usually will be like, no, we have our own contract. And then you're like, okay, you kind of look at it and then you kind of change it, switch things that you don't like. So I've done both. The South Dakota contract, they gave me a template of the contract, and everything, was cleared by my lawyer and by me. So I think it ended up working out.
And for the contracts that you're negotiating for yourself, how are you setting up your price in terms of when you play hardball with them? Because I know hospitals generally want to pay the least amount of money possible.
So there's two ways to do this. One thing, so your specialty society, at least for us, the American Academy of Neurology, they have this compensation data for depending on what subspecialty you have or what you're doing. So, for example, just to give an example, hospital medicine, with or without stroke. So they have different percentiles um, of what the annual pay would be. So then what you can do is you can take that annual pay and divide it up in daily, monthly, daily, and then hourly. So I did that work on my own where I just kind of extrapolated that data to hourly or daily. That's one way that I did it. But the other way is there is a company that I use called Resolve.com. They actually have a database of MDMA compensation data that is live, meaning that um, as they start negotiating contracts for physicians, they actually upload that data live. Let's just say a contract closes in Wisconsin, they'll update that data of how much the physician compensation was for that specific doctor. So then it becomes a pool of just live data that kind of updates, which I really like because these compensation data from like organizations, from nonprofit organizations, just like the Academy of Neurology, they tend to be a little bit skewed. And the reason why they're skewed is because there's more academic physicians pulling in that data in there. So it tends to kind of skew towards lower side. So even some of these data that you get from the Academy of Neurology can be skewed towards the lower side. So you have to kind of try to find your own compensation data through these third party companies. And I'm okay with paying money to get that data because at the end of the day, it's going to pay a lot of dividends because then you'll be on a stronger foothold when you negotiate. And then you can, they'll know immediately that you're informed when you start saying words like, well, that's within the 25th to 50th percentile, or that's below 50th percentile, that's above 50th percentile. When you start throwing those words when you negotiate, they know that you've already looked up the data and know the data. It puts you in a stronger position to negotiate.
And how are you offering yourself benefits like health insurance and retirement plans? Because I know those are the big things that people also worry about when they switch to locums or 1099 work.
So in terms of the benefits, that's kind of one of the cons of being an independent contractor. You kind of have to pay for your own benefits. I just purchased my health insurance through the marketplace. I could have gotten it through my wife, of course. If you have a spouse who has insurance, then you could get the insurance for free through your spouse if they're employed. But if you happen to be in a situation where both of you are, self-employed, then you would find a plan that fits your needs, your family's needs. So that's a whole different podcast: insurance, health insurance, and how to pick the right one for you. But for me, because I have a medical condition, a skin medical condition where I'm required to have like biologicals, I needed a health insurance plan that had zero deductible and that I didn't have to pay that much out of pocket, even if my health insurance premiums were higher. And then from a business perspective, having more expenses actually reduces your taxes. So I saw it from a business perspective and also from a personal perspective. So then I purchased, a good insurance. In terms of retirement plan, you also get a lot of benefits as self-employed. You can open your own 401k retirement account. If you're alone, you're a solo S corp, then the best thing to do is to open a solo 401k because the federal government allows you to put away up to $70,000. I think this year's up to $70,000 in tax deferred money into this account, and then that means that you can put it as as an expense in your taxes. It's a significant amount. The other way is you could pay taxes on your money and then put it on what's called a Roth account, which means that retirement money and investments grow tax free. So you do a little combination of both. So I opened up my own 401k and I decided, because I just like the stock, looking to the stock market and reading about it, to manage my own stocks. But you can also pay for like a robo advisor, which is kind of an AI advisor to tell you how to invest depending on how risky you want to be. And then also you can have a financial advisor, which I'm kind of against financial advisors because they're not looking out for us; they're looking out for themselves. So I usually just like to manage my own investments. So that I had to set up on my own. I did it through Fidelity, and I guess other benefits. And you would be surprised now. You have health savings accounts. Now there's new rulings that have allowed businesses to actually write off health, fitness. So fitness memberships are allowed to be written off as a possible expense, which we also need to take care of our physical and mental health. So that's important. Um, so yeah, there's different things that you can set up. You just have to work really closely with an accountant to make sure that what you're doing is legal and by the book, and that IRS allows it. But you just try to kind of incorporate your own expenses, personal expenses, into the business, so that at the end of the year you pay less taxes. Because I mean that's the only way to make this worth it, to balance out what it is the income of 1099 versus W-2. As a W-2, you cannot really write off almost nothing. It's really hard, and they're actually closing up all the loopholes to people that are employed in terms of what they can actually write off. I forgot to say also charitable donations. So I do that as well because I'm a board member of a few nonprofits, or like a regional advisor for some medical student organizations. So this year I actually donated a scholarship for one of my student organizations I'm an advisor for, and it was named after my last name, my wife's last name, because we're both mentors. So it provided opportunity for students to be able to travel to conferences. So then you can also do some good, do some charitable donations, and that you can write it off as well from taxes. So it really does. There's a lot of things you can do that fit with your values when you're running your own business and you're self-employed.
That's good. You mentioned taxes. So how do you handle your independent contractor taxes as compared to a W-2 employee tax?
So I do have an accountant. He's a good accountant. It took me 3 tries. No strike three. Finding a good accountant is hard. That's the first step. But pretty much I set myself up as what's called a K1. So like dividends, pass through dividends. So all the income of 1099 is housed in the S corp, and then at the end of the year, I put it at K1 for myself. I do pay my accountant to do what's called bookkeeping, because it's a lot of time and a lot of work to do that. So I pay them, and he'll put all my bookkeeping on an app, a QuickBooks app, which means I can access it through my phone. I don't need to be like carrying papers or anything like that. So it's all electronic, and it gives me a kind of clear view where the ins and outs of the S corp. The other thing that I do my S corp taxes in California, and then it passes through on my personal taxes. I filed jointly with my wife. This year I'm going to start doing something different in this. I'm going to pay myself a W-2, meaning I'm going to actually pay payroll taxes and some of the self-employed taxes, so that I can pay myself a reasonable salary. So just kind of half it a little bit between salary and what is dividends. And the reason why I decided to switch it up a little bit is because my accountant told me that if you don't do it that way, you can't have Social Security and Medicare. So it's important to pay into Social Security and Medicare. I don't know if it's going to exist by the time
Yeah.
we're old, but I mean that's another question. But if you don't do that, then you won't be eligible for it. The other good reason to do that as well is, if now with everything going on with the student loans and with the W-2, if you put half of your expenses in W-2, you can use that to effectively kind of balance out your student loan payments. So, if you earned too much with the K1, let's say if you give your K1 instead of halving it, then your student loan payment might actually go double or triple, and then that means you have to pay more every month. So it's a little bit complicated, of course, but once you learn it, it does help to be able to play around what you do with your income. Versus like with the W-2, you can't really play around. You can't really move your cash around, whatever cash you made. to balance things out at the end of the year, and you're going to end up paying more taxes. Physicians who are W-2 employed just pay tons of taxes. Like half of their income goes to taxes, especially if you're in New York and California. I mean, when you get the paycheck, it's like, what happened? I thought this was my annual salary. You just don't see anything because they take out so much, and there's not much you can do about it. Yeah, as a business, it's gonna be more complicated because you're gonna have to, read up what are the possible deductions. But when you do the math, let's say 10 years down the road, when I did the math, let's say 10, 15 years of doing this, the number was astonishing how much you save in taxes. We're talking millions of dollars. And those are millions of dollars that instead can just go to retirement or can go to a home that you're going to buy. Or it's an astronomical amount. So why would you want to be employed? I mean, after seeing that number, it's like the red pill versus the blue pill in the Matrix. Once you see the number, you can't unsee it.
I do the same thing as you. I'm an S corp as well, and I pay myself a W-2, so I totally understand the benefits. And I think it's important for the audience to know that the payroll taxes have to be paid like monthly as well. So I think
Yeah,
if there's a big thing that myself and Frank can reiterate here is get a good accountant. A good
yeah.
accountant is very necessary. I used to be able to do my own taxes when I was working W-2, but I don't recommend it. Not if you want to take advantage of all the tax savings anyway.
Yeah, same with me. Although I mean, this is information from my accountant. So you put aside the payroll taxes, you have to basically legally pay it in that tax year. But you can choose when to pay it in that year, but it has to be paid basically.
There's a lot of flexibility, and then if you really want to learn what your accountant is doing, now that we assist in the era of AI, I have actually asked ChatGPT, so how does the numbers work in the percentages? And actually, it tells you, so it gives you an idea. Now with AI, you can just learn so many things. So that way, you're not totally blind. And I mean, it's not that I don't trust my accountant, but throughout the years, I learned you trust, but you check, right? You kind of have
Verify.
to verify. Yeah, I was looking for the word trust, but verify. Very important because physicians are always there's somebody always trying to take advantage of us. Unfortunately, I have to say it out there. I get all these LinkedIn inbox messages of financial advisors, and once it says the word investment something, I just say ignore. Everybody is trying to get a piece of the chunk. Um, so you have to be kind of very, very. Your eyes have to be wide open and checking everything, even when you have somebody who's taking care of things for you. It's important to verify. It's important that since you're opening up your own S corp, the most successful people in business are the people that know a little bit about everything. That is actually true. You have to learn a little bit about accounting. You have to know a little bit about tax planning. You have to know a little bit about investments, finances, marketing. Not trying
Legal.
to scare, not trying to scare the audience, but you kind of learn it as you start doing it more and more. You start learning it, but you do have to know a little bit of everything, and that can have its benefits and its challenges.
I think that's always good to all know where your money's going too, right? I think when I was a W-2 employee, I was just kind of like, okay, well, take my 40%. I'm
Yeah,
not going to see it. Whereas now I'm thinking more like a business person and go, okay, so what can I write off? Or how can I make this the most tax efficient for myself? And I think the biggest misconception, and I used to think like this as well, is that I'm a doctor, I'm not a business person. But the reality is we're so smart, right? Like we've gone through so much schooling. Like
mhm,
if a financial advisor can learn this stuff, so can you. Like there's YouTube, there's like Chat GPT.
yeah.
You have to be invested in your own finances. Otherwise you're gonna never be able to retire the way things are currently going.
Physicians unfortunately get exploited because they're
Yeah.
not looking at their finances, and they don't know the details, they don't know what's going on. So and they're like, oh, we're just doctoring, taking care of patients, but the reality is that's why things are changing, healthcare systems are changing, physician compensation is stagnant, and the expectation is more and more productivity, but the pay is stagnant because they're like, oh, we're busy taking care of patients.
And if you look at physician compensation, going back 30 years ago to now, like if you look at the percentage of how much our income has increased, it's been negligible. It doesn't even keep up to inflation. I'm talking about like employed physicians. So these hospital systems, these clinics, they're just taking advantage of us. And the reason why they're doing it is because we're just not educated enough on business and financing and all these things. And the root cause of that is because in our training, they just taught us just to be, little soldiers for these hospitals and to keep your head down and keep working and to just focus on the patient. They take advantage of our altruism, and the reason that why we went into medicine is to take care of people, take care of the sick. But they take advantage of us because in the United States, healthcare is a for-profit business. So these administrators, that's all they care about is what's the bottom line? Am I balancing out my you know my income versus my expenses? And all they care about is paying themselves and their shareholders bonuses. They really don't care how did you get there. They have to cut out physician compensation, which for some reason they always go after the physicians, or if they have to cut out benefits for the patients. So unfortunately, that's kind of where we're heading to with all this private equity takeover, is even giving less power to the physicians and more power to Wall Street and administrators. So if we don't take action, we don't empower ourselves and learn this stuff, our profession is not going to go to the right place. We're already seeing it. Other ancillary staff are taking over our jobs. Who knows? Maybe they'll use artificial intelligence as well to take over our jobs. So we really have to start educating people about the importance of knowing all this stuff.
Right. And that's why we started this podcast, to educate the medical students, residents, and other physicians about these issues, and to look for red flags from the beginning, from early on. Look for jobs that value you. If a job is not valuing you, then move on. There are jobs that value physicians. It's just you have to go find them. They're not going to find you. You have to go find them.
Again, in training, they kind of ingrain into us like you should just take whatever job that is offered to you and just take it and don't ask questions. The data is pretty clear. Most people fresh out of training, once they go into a job, they don't even last. I think it's up to 2 years. That's the average that they last before they move on to the next job. So I think that's we're creating a huge disservice for trainees who, where they go out there, they're told that's the holy grail, to be an attending physician, you pass all your tests. Now the good life is going to start. And that's just simply not true. It's simply not true unless you really make the right decisions, meaning the right financial decisions for you. So we really have to start opening the eyes of the trainees, and I mean even mid-career physicians who are burned out, or young physicians have to open their eyes about the distinct possibilities, both in clinical work and non-clinical work.
We're going to pause here for this week, but don't go too far. We'll be back for part 2 next week, and we'll tune into the rest of the conversation. Thank you.
Thank you.